Away from politics and law and order, the front issues of late in the new Hela province, it was a peaceful, purposeful gathering this time in the provincial headquarters of Tari. It was health and the work of the provincial hospital there. Leaders at all levels were on the same page here. Kevin Deonga reports.
Differences aside, member for Korobalai Kopiago Philip Undialu and member for Komo Magarima Francis Potape were present with Taripori MP to witness the launching of the Hela Provincial Health Authority.
Yumi got two, Namelo Yumi, Chairman Block Provincial Health Authority.
Thousands braved the hot sun and gathered at the hospital premises to be part of this significant event. Minister for Health and HIV Michael Malabag, while officiating the launch, said the government has initiated strategies to effectively address health issues. With the authority being established, Minister Malabag said it is aimed at removing impediments and barriers that hinder service delivery.
Provincial Health Authority is the way to go. It is the recipe for elimination of program and resource duplication, the prevention of confusion, and improvement in the management of health service delivery.
Malabag urged everyone to take care of the health facilities. He guaranteed the Hela people and the hospital staff that funding will continue to come into the hospital.
Chairman, now members of the authority, under this new arrangement, I must guarantee you that funding and support from the national government will still continue to come to your hospital directly.
Member for Taripori and Minister for Finance and Leader of Government Business, James Marape, added that amidst issues plagued upon the new province, good things are now unfolding in Hela province. He thanked the hospital staff and former CEO, Dr. Hewali Hamia, for driving change in this sector.
Plan must, plan blow youth solo housing. You must give him copy blow plan long provincial government, copy blow plan long district, copy blow plan long councillors, copy blow plan long churches. Now we're going to stakeholders of some Exxon Mobil, program sets of somebody be like thank you Lord. PJV, plenty time, what the world said, you stand up, come. Give him this law plan, law people longer the sector so that people are looking. Now people say want him or legally help or people make him walk. Want him help, province make him work. Want him help, churches make him work.
In line with the provisions of the Public Services Management Act and Public Finance Act, the Hela Hospital will be accountable to the provincial and national governments. It is said in establishing the health authority will strengthen the work that was done by Taripori Hospital that serves more than 300,000 people in the province. Dr. Haliwa Hamia is the person behind the success of this hospital. During a short period of time, the hospital has achieved a lot. Beginning of this year, the hospital was declared a Level 5 status with staff structure and funding.
Some of the very important things that we have done, first thing was when Hela was just about to declare a new province on the 23rd of November, we did a Hela strategic implementation plans through the coordination from the National Health Department. And the National Health Department, Health Minister, Secretary, your team, you people have been very supportive from day one, and then this progress was because of your continuous support. DPM, Prime Minister, Health Minister. So our corporate plan, Hela deployment. So Hela, you're talking about, I've seen some Bosabis, Hewas, Openas, Huli, whole of Hela coming here to demonstrate the cultural source and come here to witness this. We have not forgotten you. We have already mapped you inside. What are the health facilities that you have? Whether churches or government health facilities, or even not developed, we have already mapped you inside in this development plan. So this plan is going to continue until 2020.
Secretary of Health Pasco Kase says all staffing issues will be a thing of the past now.
We like encourage all health workers. Leader governance authority and board. Let them make the decisions. Now you me all workers, you be implementing. I'll seek a provincial health authority by working plan. But all money now, our DDAs or local members are holding on to the funds for infrastructures. So you must plan and share that plan with our leaders so that they make sure that it's their business. We're assisting me in development infrastructures because me looking plenty infrastructure like me, for certain highlands, for plenty have no country, especially in the rural areas, and still it's not no good yet. Plenty will come up good, but more work needs to be done.
Among its achievements, Janet Korima was the only woman that was sworn in among 8 other men as board members for the newly established Hela Provincial Health Authority.
I, Janet Korima, do strongly promise and declare that I will well and truly save the independent state of Papua New Guinea and its people as a member of the Hela Provincial Health Board, Hela Provincial Health Authority Board. So help me God.
The new board came into effect after the launching of the Provincial Health Authority last week in Tari. They proceeded to have their first board meeting in the hospital premises to elect a new acting CEO of the Hela Provincial Hospital. The newly established board will now be headed by Peter Botten, Managing Director of oil and gas company Oil Search Limited. Botten says it was important for the company to partner with the government and address issues of concern in the impact project areas.
We are delivering better services. We've recruited staff, more than 160 staff we've recruited, more to come. We've recruited doctors. We're bringing skills, new training to our people and our staff in Hela Hospital. Much more to come, but it's started. We've developed the medical ward. We've done water bores. We've done some key infrastructure. We're building the skills of our Hela staff in Hela. That, I think, is a massive win, and thank you for your help in making that happen.
Community leaders representing the 3 electorates were among representatives from the health department, barrack, churches and local businesses. The board members were challenged by 3 of their local members to work with the stakeholders in the province to drive health services further to the majority of the people living in the Hela province. The documents were signed by Minister Malabag representing the national government and acting governor for Hela province Francis Potape representing the provincial government.
Kevin Deonga there, ending another edition of PNG Tonight. Thank you for your company. Another show tomorrow. I'm John Higgins. Good night.